Evidence-based practice within nursing involves asking clinical questions that can help deliver the best quality care for each patient. The ability to effectively conduct a literature search and find reliable evidence will ensure evidence-based practice can be implemented. Is ibuprofen more effective than paracetamol in the treatment of pediatric fever? I'm conducting a literature search to identify the highest level of evidence that can support or answer this clinical question. To make an effective search, first step is to identify keywords within this clinical question. The PICO framework is often used in evidence-based practice to break down the question into key ideas and terms that need to be focused on to find the best evidence for the question. In the PICO framework, the acronym relates to P for population or problem, I for intervention, C for comparison, and O for outcome. In this clinical question, I have identified the population group of pediatrics. Our intervention is ibuprofen, and ultimately its effectiveness. Comparison paracetamol, and our outcome is fever treatment. Then I begin to search for alternative words for my keywords. Using the UOW word search generator and a thesaurus, I searched for synonyms for each of my key terms. I found the generic and scientific names for ibuprofen and paracetamol, also finding synonyms for pediatric and fever treatment, giving me a sufficient bank of terms to use for my database search that relate to my clinical question. Having alternative words helps to broaden the results of the search by identifying results that are relevant to the topic but using another term. Starting with a greater amount of sources will allow me to start big and then shuffle through to find the small amount that directly relate to my clinical question. I'm now happy with the different terms I have found, which will work together to find evidence related to the clinical question. The next step is finding the database for my literature search. Using the UOW A to Z database, I chose two health databases to use for my literature search, CNAL and Medline. CNAL stands for Cumulative Index of Nursing and Allied Health Literature. It is identified as one of the largest and in-depth nursing research databases. Both databases also state they include full text, which is favorable to be able to analyze evidence successfully. Being able to read and access the whole text will allow for the best result to be identified. Medline database broadly covers a range of areas involved in research and clinical care for health professionals, including worldwide journals in full text. Effectively using both CNAL and Medline databases, which both encompass the nursing and health profession, the evidence results will be related to medical outcomes and interests that will give the best results in answering my clinical question. The next step in using my databases with my key and alternative words to conduct a literature search. Also important in this step is how I use my words and alternative words. The use of Boolean terms, including and, will guide the results of the search. Using these terms will determine whether the words either side are both found or whether one or the other is found. Using the word and between three of my key terms from my PICO framework ensure these terms are all found in my search, while using the word or between my key and alternative words, then extended my search to identify results where paracetamol or Panadol appears. In my first search, I used alternative words for three of my key terms, searching in both databases at the same time, and the search blew out with over 1,000 results. For my next search, going through over 1,000 articles is unrealistic and ineffective in finding the best evidence. I therefore need to limit my results. I added my last key term from my PICO framework, being the outcome is fever treatment, as I noticed many of the results weren't specific enough to fever in pediatrics. I also searched each database individually to see how many results were found and also the level of evidence of their top results. Still, in both searches, I have found over 100 to 200 results, which still isn't effective enough to be able to find the best resource evidence for practice. I also found the top results weren't specifically looking at fever or the comparison of ibuprofen and paracetamol, therefore ultimately not giving me the best evidence for my clinical question. With so many results, more refining needed to be done. I refined my alternative terms to only include my keywords to narrow down the results. I also added a publication date filter to ensure my results would be the latest evidence. I also added effectiveness after ibuprofen, as I wanted the results to specifically focus on comparing my intervention and comparison. Successfully, my search is narrowed down to 11 results, which is a realistic amount for me to be able to search through to find the best highest level of evidence. Immediately, I recognized the top two results are both high levels of evidence, being a randomized control trial and a systematic review, both comparing my intervention and comparison involving my population and outcome, ticking all my PICO framework terms. Seeking high levels of evidence ensures to seek reliable sources to efficiently answer clinical questions. A systematic review involves collecting many studies from researchers and analyzing this data. Ultimately, instead of me reading hundreds of studies, a systematic review collates the evidence for you from the researchers' findings. This also makes this a secondary source as they are using other researchers' work to create their evidence. Looking at each of my top results, I decided the systematic review produced the best evidence for my clinical question. The randomized control trial focused on a specific population group of children in Nigeria, which I believe made the results limiting. A systematic review is the top level of evidence as it follows strict assessing and literature critique protocols. This systematic review included 8 pages that had gone through strict critical appraisal to be included. I found in this particular systematic review it doesn't come to a definite conclusion. The results are simply inconclusive because there is gaps in the research. Ibuprofen was slightly more effective in reducing fever than paracetamol, however this difference was not statistically significant. This systematic review presented the most reliable evidence for my clinical question with no definite answer. This gives opportunity for clinical interpretation to whether you believe this to be relevant in your evidence-based practice. I chose the Gibbs reflection model for my reflection on my literature search. Working through the Gibbs reflection, the description for this task is conducting a literature search according to your chosen clinical question, identifying and analyzing the data to find the highest level of evidence. My feeling at the beginning of the task reflected a basic database search, which shifted to identifying the simple but powerful importance of Bohemian terms and the PICO framework set out. I found the PICO framework to be straightforward, but also found myself overthinking if I should include other words such as effectiveness or treatment. The simple components of the search became the parts I would overthink. The blowout of information truly blew me away, which became overwhelming. It emphasized the importance of using the PICO framework to ensure you are identifying the key elements in the clinical question. In my evaluation, each set of results I was finding the really high levels of evidence, but they didn't meet or answer my clinical question. The difficult part of this experience I found is the database is only open for a certain amount of time before you have to refresh the website and search all your terms again. I wasn't able to leave the database search open and come back to it with it all there. In analyzing my experience, I found having past experience with using databases, the tutorial lessons, and the assessment-based Zoom session, I was able to collate all the knowledge and steps towards making my database search successful. The group discussion forum was also helpful as many of my concerns and questions had been answered as other people were experiencing these concerns as well. I believe through my clinical judgment of this question and the key terms I did identify, I was able to find the best available evidence in the conclusion. During this experience, I learned the importance of the first step of PICO framework. Identifying these key terms creates the direction for your search. I also learned how to search across 2 databases at the same time, both skills improving my literature search. For areas of improvement, I think I need to improve on my evidence critiquing skills and critical reading. The last step in my reflection is the action plan. For my future self, through this reflection, I have identified what I found difficult and what I had learned. I believe practicing these skills of retrieving information that can support our evidence-based practice is extremely important. Using the PICO framework, working through filters and Bohemian terms to assist in making literature searches efficient is something that can fit into my practice as a nurse. If I was a patient, I would want my nurse to be implementing evidence-based practice and asking clinical questions to ensure I can receive the best quality care. Evidence-based practice aspires to benefit all parties involved in healthcare, the nurses, the patient, and the health system itself. The World Health Organization in 2017 highlights the feelings of empowerment many nurses experience when they can deliver the high-quality care through the use of evidence-based practice. Being able to database search efficiently gives nurses the opportunity to have access to so much evidence that can influence and challenge their practice, encouraging the best outcomes to be delivered to the patient always. In conclusion, my evidence found for this clinical question, I do not believe it would change my clinical practice, but it was eye-opening in the beginning to continue implementing evidence-based practice. Thank you.